Hello everyone, I am Dr. Kieren Bong from Essence Medical Cosmetic Clinic in Glasgow. I have been in aesthetic practice for 16 years and have had the privilege of teaching doctors and surgeons in more than 60 countries. Today, I want to talk about a brand new botulinum toxin that has just arrived in the UK, Relfydess. We are one of the first clinics in Scotland to offer it, and I know many of you, patients and clinicians alike, have questions. If you are new here, welcome. If you find this helpful, please like the video and subscribe for future updates. First question, why all the buzz with Relfydess? Relfydess sits alongside names you already know in the UK, such as Botox, Dysport, Azzalure and Nuceiva. The headline questions I hear are very consistent. Is the onset genuinely faster? Does it last longer? Is there anything meaningfully different in the science or in day-to-day use? And how does it perform in real clinics, not just in clinical studies? Let us unpack all of this clearly and calmly. So what is Relfydess in plain English? Relfydess is a botulinum toxin type A. Its specific name is botulinum toxin A, and it is developed by Galderma, the company behind Restylane. What sets it apart is that it comes from a unique proprietary strain and is produced using a patented method known as the Pearl process. In simple terms, Pearl keeps the toxin in a liquid state from extraction right through to the final vial and removes complexing proteins. The idea is to preserve molecular integrity, improve consistency, and reduce factors that might contribute to antibody formation. Most other aesthetic toxins you and I use derive from the Hall strain of Clostridium botulinum and are shipped as a freeze-dried powder that we reconstitute before injecting. Relfydess is different on purpose. The above said, does it work faster? This is one of the most exciting parts. In clinical work led by Dr. Sachin Sridharani, 39% of patients showed a response to Relfydess within 24 hours of injection. That is unusually quick compared with what we expect from other type A toxins, where onset is typically several days. Colleagues in Spain, Germany and France who have used it report a similar early kick-in, and this aligns with my experience so far in clinic. What does that mean in real life? If you are getting ready for an event, or if you simply prefer not to wait a week to see movement soften, a faster onset can feel very reassuring. On to longevity. With Botox, most patients sit in the 3 to 4 month range. With Azzalure or Dysport, many see 4 to 5 months. Early clinical data with Relfydess suggest that at 6 months, a substantial proportion of patients had not returned to baseline in areas like the glabella and crow's feet. In one dataset, about 75% had not fully returned to baseline at the 6-month mark. This is encouraging, and it matches what I am starting to see in practice, although we always want more independent, longer-term studies to confirm it across populations. If this durability holds up at scale, it can mean fewer appointments per year without compromising results. For many busy patients, that is a genuine quality of life improvement. What about spread and precision? Diffusion matters. We all know that some toxins have a broader field of effect, and others are a bit more localized, which we can use to our advantage depending on the area. Research suggests that toxins without complexing proteins tend to have a smaller field of effect. Because Relfydess lacks complexing proteins, we would expect its effect to remain more localized, offering precise control in delicate areas. This is particularly interesting for fine-tuning brow position or managing lateral canthal lines while preserving natural expression. We will now move on to the Pearl process. Let me expand on it, because by maintaining the toxin as a liquid throughout manufacturing and removing complexing proteins, Pearl process aims to protect the active neurotoxin and enhance stability. The goal is consistency from vial to vial and potentially a lower risk of antibody development over time. From a clinician standpoint, anything that reduces variability helps us deliver more predictable outcomes. The next concept to discuss is volumetric dosing, and this is clever. Here is a practical innovation I like. Relfydess vials arrive pre-diluted to around 1.5 millilitres with a fixed unit count per vial. That means dosing becomes a simple matter of volume drawn rather than depending on how perfectly a practitioner reconstitutes a powder. In the real world, little things influence potency: storage fluctuations, how vigorously the vial is shaken, how quickly saline is pushed in, minor drawing errors like 0.61 millilitres instead of 0.63 millilitres, and even how fast you push the syringe into tissue. Relfydess's volumetric system removes many of these variables, so we can dose with greater precision and repeatability. How does this change day-to-day practice? If many patients can reliably reach close to 6 months between treatments, here is what changes. 1. Convenience. This means fewer visits each year, which is kinder to diaries and travel plans. 2nd. Satisfaction. A more predictable early onset can ease the anxiety of waiting for results. 3rd. Continuity. A consistent vial and dosing system means fewer surprises and smoother reviews. From a business perspective, fewer appointments might look counterintuitive. In my view, the best long-term strategy is always to do what is best for my patient. Happy patients return, tell their friends, and stay with you for years. Who might be an ideal candidate? First, patients who are new to having cosmetic botulinum toxin, who want a reassuringly quick sense that treatment is working. Second, time-poor professionals who prefer fewer yearly appointments. Third, patients with reduced longevity on their usual toxin. Sometimes, over years, a small number of people feel their toxin does not last as long as it used to. A different strain like Relfydess may offer a fresh response. As always, we will assess each face individually. Dose, pattern, and product choice should match your anatomy, aims, and lifestyle. With all the above said, what is my honest verdict so far? I am impressed by 3 things: the speed of onset, the promise of longer duration, and the smart, consistent dosing workflow. The science is thoughtful, and my early clinical experience has been positive. That said, I am always cautious with any new product. We will continue to collect data, review independent studies as they emerge, and share what we see in the clinic over time. If you are curious about Relfydess and whether it is right for you, book a consultation with me at Essence Medical. We will go through your goals, examine your anatomy, and decide together whether to use Relfydess or another well-established option. There is no one-size-fits-all in facial aesthetics, and that is the beauty of it. Thank you for watching. If you learned something new today, please give the video a like, subscribe for updates, and share this with someone who might find it helpful. I will keep you posted as more evidence comes through and as our own case experience grows. See you in the next one.